So this has been extremely informative. Before we end this discussion, I'd like to get final thoughts from each of our panelists. Dr. Beer, can you summarize our discussion here as we've talked across multiple gynecologic cancers, ovarian, cervix, and endometrial cancer? What's the unifying theme?
Tom doesn't know what twist is. Okay. No,
Maybe you can explain it.
I think if I were to summarize it, and we touched on it, which is, and maybe because I'm the oldest person here, I have a slightly different perspective, but 15 years ago, we were arguing about IP versus IV or Taxol versus Taxotere. We've seen a revolution here, and now it's in all three tumors. It's been in ovary a little bit over the last 5 to 10 years, but now it's in endometrial and it's in cervix. It involves accurate stratification of the patients, active drugs that we didn't have, and potentially we're beginning to see some payoff in cures, I think.
Interesting. Krish, give me your summary.
Yeah, I think the bottom line is we're finally catching up with where we need to be, and we're sequencing our tumors.
So
we're not
biomarkers.
Yeah, biomarkers. We're not sitting there thinking about, should we heat the chemotherapy up? Should we pour it in the belly? Should we use an analog? Should we change the dose? We're like moving forward finally.
So BRCA, HRD, and ovary.
Yep.
PD-L1 and HER2
To a lesser extent.
in cervix,
Yeah.
and MSI and HER2 in endometrial.
Yeah. I love it.
Great. I think this is just a time of incredible progress. And I think that's the word that is underlined in all of these discussions. We have incredible technology. We have a lot of different compounds. And now I think over the next few years, we're going to see how we need to tweak it, how we should use these compounds to best benefit our patients.
Sequencing, right?
Absolutely.
Yeah.
That's part of it.
Tom?
I think the themes that emerge from looking at where we are today and where we're heading in the immediate future are really combinations. It's about the science, and it remains about clinical trials, and that's really been the driver for all the content that we've been able to hopefully convey today that has changed practice for our patients, and I think we need to continue to do that. And the other note I would say is that I think it's increasingly harder to keep up because of all these complex studies and these combinations and so forth. So if you're going to treat ovarian cancer, if you're going to treat cervical cancer, if you're going to treat endometrial cancer, it's changed. And it's going to be a challenge for physicians and providers to keep up.
Yeah, if I was to choose one unifying theme, it would be anti-angiogenesis. Krish, with your passion, we got bevacizumab FDA approved in cervical cancer. We have 3 approvals in ovarian cancer, and now, Michael, you told me that lenvatinib may improve the efficacy of pembrolizumab in mismatch repair proficient tumors. So that is a unifying theme across all 3 tumor types. But each of your points, whether it be clinical trials, following the science, okay, I really appreciate it. So on behalf of our panelists, I'd like to thank you so much for being with us. I hope you've enjoyed this peer exchange discussion, found it to be useful and informative. Thank you, and so long for now.